Hey, good morning, friends, family. Uh, Little update from yesterday's events. And just to let you know, this is take two of this video. Uh,
Lori had too much morphine.
or had a little too much morphine in the one we shot last night. So, uh, anyway, we'll just leave those colorful words and things that might have been dropped in that one on the edit room floor, and we'll move forward this morning with this one. So, with that being said, we just wanted to bring you guys up to date on the events of yesterday. Uh, Sorry for the delay in getting this out. I know people were either anticipating this video or text messages or some kind of post on Facebook yesterday. And so I'll just kind of start right there with that first, and then we'll talk about the day's events. Um, just know the official word of what's going on with Lori and her visit for the day, what the treatment is, and all that will actually come from Lori herself or through me. As she stated a couple weeks ago, I'll be the one to communicate that out there. So I'm not going to communicate anything until I 100% know that she is comfortable with what I'm going to share with family and friends, whether that's through a text message, a Facebook post, or if one day she just asked me to shoot one of these videos out there just to give you guys an update because she doesn't feel like being on camera. And I think what happens is a lot of times, people hear one word like chemo or something like that, and they don't get all the information, and then that gets everybody all worked up and worried, and then they start firing text off at Lori, and she's like, "Did you tell so and so this?" And I'm like, "I have no idea what you're talking about." So just know that the official word will either come through one of these videos, a text message, or an Instagram, or a Facebook message or something. Once I know what Lori wants, I will put that out there. Like yesterday, I shot something out to some immediate family. Yes, it was very generic, but at that time, that's all we really wanted to discuss. And I hope that you can and will respect that. So, with that being said, let's talk about yesterday. I think that it was going to be a very nerve wracking day. As the person that was just sitting there observing and holding the hand, I know that it was painful for me to watch that bone biopsy procedure go down. And Lori will definitely elaborate on her thoughts and feelings about that here in a little bit. But I can tell you, as the observer, it was everything that it was cracked up to be in what you read and maybe the videos that you watch. But the team over there, awesome. Made the experience, I guess you could say, as comfortable as it could be in an uncomfortable situation. So I'm just going to kind of give you the highlights of what happened yesterday. We'll try not to repeat ourselves too much. And then Lori's just going to kind of give you some thoughts on how she's feeling after yesterday's events. So the first thing that went down when we got there to UT Southwestern was that we met with Dr. M, slowly trying to get that name down. Dr. Monadot, I think is how you pronounce it. I think I'm getting better at it. So we meet with Dr. M. Not that it was, a news flash. Of course, when we met with him early last week, if you'll remember, he wanted to get his own results and put his own official stamp of CML diagnosis on there. And of course, he did reach out to Lori last Friday afternoon and give her that. Or I think it was actually last Thursday. He called her and gave her that official diagnosis because he was able to obtain the information that he wanted from the FISH test. So really, at this point, the purpose of the bone biopsy yesterday was just kind of to find out what stage or where she's at with where we're at with everything. We won't have those results of the actual bone biopsy till we see him on October the 4th, I believe now. That's kind of up in the air we've got to check the portal because I know the paperwork we got said October the 4th, but then somebody was saying as we were walking out the door that the date and time may be different on that. But sometime in the next 2 weeks, we'll see him. He'll tell us the findings from the bone biopsy. So he did go ahead and, he went through kind of a series of questions asking her how she was feeling, how she had been feeling physically over the last week. The two biggest things that she continues to struggle with, but it is a common I don't know if you'll call it a side effect. One of the things that comes along with CML is you kind of bust out into a fever here and there. And that's definitely something that Lori has been experiencing since February, is just periodically she'll feel all body achy, and she will have fever. And she might check that temperature once, and it's there at 100.6, and then 2 hours later it's normal again. It's down in that 98 range or 97 range. So he made notes of that. And then the biggest thing I think that through our whole conversation with him that we honed in on was this continued high pulse rate that she has. And that's something that she's been experiencing since February. And so he really feels that the high pulse rate has nothing to do with the CML diagnosis. So he wants her to get a consult with a cardiologist. So after we got out of there yesterday, she reached out to her PCP. She did get a phone call late yesterday afternoon from the PCP office that said they had sent a referral out. So I'm sure somebody will be reaching out to her on Monday or early next week to get that appointment set up. So we can just find out, because she is still continuing to have that high pulse rate. This past week, one morning before she left to go to work, I think it had gotten up to the highest ever gotten. I think we're like somewhere in the 168 range. So definitely want to get that checked out. So we talked about the physical things that have been going on. And then, he did go ahead and tell her, based on what he found in the fish test, he had decided on the medication he was going to start her on. Of course, with CML, instead of it being an IV type of chemo, those things are done orally. So he has chosen the Gen 2, one of the Generation 2 drugs that came out for her. I cannot pronounce the generic name. I'll spell it for you. It's DASATINIB. But you're going to probably more than likely find it in your research as the name we know it now, called Spiracel, SPRYCEL. It does come in different milligrams. We're going to go ahead and go for the strongest dose to get this party started, and so he's decided to put her on 100 milligrams once a day. So we did pick that up from the pharmacy yesterday, and she'll be starting that soon. I'm sure they would have preferred that she started it as soon as we got out of there yesterday, but the ball's in her court, and I'm going to respect her decision, and I ask you as family and friends to respect that as well. She may start it today before I get back home from work. She may start it tomorrow. She may start it Monday. I don't know.
She may not start it at all.
That's Lori's call, and we're going to respect her and let her do her thing. The other thing is there's another common drug out there that I want to say CML, probably all leukemia patients are put on, and that's something that really helps get those white blood cell counts down and get those counts back in check. And I'm going to lean on you to remind me of the name of that. We have it over at the pharmacy to pick up Hyretha, I think is how it's pronounced. Excuse us if it is a little early Saturday morning, not enough coffee yet, but we do have that one to pick up as well, and that's going to kind of assist in getting some of those counts in check. The other thing a couple of things. Once they got labs drawn yesterday after we had met with him, he called her on our way home, and her white blood cell count just in a week and 3 days has gone up. It's already extremely high. Last Last week it was 60,000 when she had met with her PCP 2 or 3 weeks ago. That's what got this whole process started. It was 60,000 then, but just in a week and 3 days, it's gone. And I'm not giving you the exact numbers, but let's just say it's gone up another 16,000. So if she was 60,000 last week, she's just a hair under 76,000 this week. So we'll just go ahead and go with 76,000. So it has really extremely gone up in a week. So that's why he wants her to get that Hyretha or whatever it's called, and get that started for sure. And then she'll be getting the Spire Cell started. So the other thing that's high is because when you do have this extreme blast of the white blood cells, the not good white blood cells, which is why we have this whole CML thing going on, when those dead white blood cells break, there's an increase of uric acid in your system. You may know the word uric acid from gout. So he's given her some medicine for that to get that uric acid count down as well. So those are kind of the three medications that are now going to be part of her regimen going forward here in the near future. The next thing is
Hydrea.
Hydrea. There we go. Hydrea. Thanks.
Hydrea.
And now we have that out there as well. So that was pretty much, that's kind of a Reader's Digest version of our meeting with him. The next thing was we had a couple of more things to go, with the grand finale being the bone biopsy. So after we met with him, and talking about the high pulse rate, kind of a on the spot impromptu thing, they went ahead and did a stat EKG on her. Everything was fine with that, just like it was a couple weeks ago. So there again, that's why he wants her to see a cardiologist, because we keep doing this EKG thing, and that's coming back fine. So we did do that. And then the next meeting, we were to meet with the pharmacist and talk about the Spire Cell. And so basically, in super nice lady again, just doing her job. Obviously, she went over the side effects. You guys can Google Spire Cell and look at the side effects. But before you get alarmed, just know that yes, there's a whole list of side effects. And the reason there is a list of those is because when this drug or any drug is in clinical trial, the manufacturer has to put out there every side effect that was reported by anyone that was on the trial of the drug. So you'll see all these side effects. Lori could have some of those. Lori couldn't have some of those. Every person reacts different, but I'm sure that there are some on that list that she is going to get. So definitely keep those thoughts, prayers, good vibes coming her way as she starts that journey on that. You guys, when she starts it, you can see what she might be in for side effect wise, but know that she's not going to have every single thing you read. She'll probably just have, whatever ones her body decides for her to have. Pharmacist just doing her job and talking about the side effects. I think the thing to realize here is obviously when you have any type of leukemia, or definitely with the CML, just because you got this, you've got an extreme high white blood cell count, which is not good. And white blood cells are what obviously help fight off infections within her body. But she doesn't have good white blood cells right now that can help fight off infections. So she is very prone to infection right now. And so last night in the video that we shot, and I'm sure that's going to come out here in a minute, it's very, very raw and very real that, right now, and I would be the same way if I was in her shoes. It almost feels like you have to live in a bubble. And so, of course, I started having flashbacks to Seinfeld when they visited the Bubble Boy. But we're not going to be living in a bubble over here in Southwest Fort Worth. We're just going to try to do life as normal as possible. but probably have to be precautious in some things. Obviously, being around people that are sick. If I get sick, I need to wear a mask or go check in at Motel 6 or something like that, because she is very prone right now to infection. So it was very, I think it was very disheartening to her, because, I mean, the pharmacist was doing her job, and I know I've said that 100 times. I'll probably say it 100 more times before we turn this video off. But it was very disheartening to her, because a lot of things that she likes to do. I guess the good news is these are things we just need to be cautious of, at least for the first 3 to 6 months till this medication starts doing their thing and we get those levels down, and then maybe she doesn't have to be quite as bubble living as it was presented yesterday. But we love going to the pool, and right now she doesn't need to be going to the public pool, because we don't know who went pee-pee or poo-poo in the pool, and so she doesn't need any infection from that. Loves to work in her garden. Thank goodness there's not much left out there. We've got some jalapeno peppers to pick, and then garden will be closing down for the year. The deal with the garden is just when you got to pull things up, or there's all kinds of spores and stuff on plants. The pharmacist was very complimentary that Lori likes to grow her own food. Was appreciative of that organic approach, but did warn that if she does work in the garden, she needs to wear a face mask and gloves, and she would need to put those clothes in the washer immediately when she comes in and take a shower. And so if you're any one of our surrounding neighbors and you look over the fence and you see a lady out there with a mask and gloves on, it's okay. She lives here, so she's not out there robbing our garden. We leave that up to the rabbits and the squirrels. So anyway, that was kind of disheartening just to kind of hear the do's and the don'ts. But we're going to adjust on the fly and work through that. And then here comes the grand finale of our time over there yesterday at UT Southwestern, and that was the bone biopsy. And as I said, and she's going to probably elaborate a little bit more here in just a second, it was everything that we had read and watched and all that. And but I will say the team was amazing in making her as comfortable as possible. So normally they just do that with giving you a local right there at the spot at lidocaine. But her doctor did agree to let them do an IV and give her some morphine and some Ativan. But
it wasn't enough.
Just as we were getting ready to get the procedure started, they had actually already started the lidocaine process. And I could tell by the grimaces and stuff on her face, just them doing that part was very painful in itself. And so just before they got ready, they kept asking. They have a series of tests that they do. So their biggest thing is they want to make sure that spot is very numb. And so they would say, does this feel like pressure, or does it feel like I'm cutting you? And the key word was pressure. So once she was feeling like it was just pressure, they knew that the area was numb. That doesn't mean it's not going to hurt.
Right.
But
that's for sure.
So then they proceeded on with that. I've got some pictures I'll show you guys here in a second, but I just realized that I don't have the pictures here in the Lolo studio. So we'll let Lolo give her thoughts and feedback on the procedure in just a second, and I'll step away and get that. So once they got the area numb, there was a hole, an incision that they had made, and they go down into that. There's like a 22 gauge type cylinder that goes down in that hole, and inside of that cylinder is a needle. So on one end if there's a needle, the other end there's like a little, I guess you could say, device, a plastic device on there that's you then put a drill motor on it, and that spins that needle around. And so when I had looked at videos and researched it kind of said, compare it to your trip to the dentist. They deaden your mouth, but you still feel pressure, and you hear all that crunching and noise from the machines going on. And that's exactly what it was. So you hear this drill going off. They get into the bone. And then the next part was, so the two things that they were accomplishing through this was they needed to do get some fluid out of there and aspiration. So they got that needle down in there. They take the drill motor off, and then they put there are 4 different times they did it. And so they already told her, we'll take 4 samples of fluid out, and each time they would put a syringe on the end of that cylinder, and then they would pull the plunger back up. And they would say, okay, we're getting ready to do this. I need you to take a deep breath and then as they start pulling, they would have her release that breath. And let me tell you, she came up off the table, as I would, all 4 times that they did that. At that point, I think she had forgotten that there was another step to the procedure. And so they took a minute to just let her recompose. And then make sure she was still feeling numb in that area. And then they needed to get a sample of the bone, the tissue. So then they put the cylinder back down in there and took the drill motor on there again. Found that they were kind of going in a different spot in the bone, in the same area still. Got it in there. We did the breath thing again. But they had already told her this is not going to be like what you just went through a while ago. And it still hurt, or still was very pressure hurting. But they got that bone sample out. And then they just have to real quick, there's a technician from the lab in there. They give him the sample. He does his little magical thing and says, yes, this is a good tissue. Thank goodness.
Right.
And then we're done. So this sounds very long and drawn out. I wasn't the person going through it, so it probably seemed like this all was taking 5 or 6 hours. But once they get the area numb and they go in and when we get to the part where they're getting the fluid, the aspiration out, and getting the bone sample out, they were done in less than a couple of minutes. So,
which it didn't feel like a couple of minutes,
right.
so that's for sure.
And so they, I guess you could say, they called it at 2 o'clock as being officially done. And so they told her they cleaned her up, put a patch on it, dressing on it. And so they told her for 24 hours she needed to leave that patch on there. So today at 2 o'clock, she can take that patch off, take a shower. And they just asked her to, avoid swimming or any type of like soaking in baths and stuff like that for like 3 days. But
not that I can go swimming.
I was going to say, but the pharmacist has already said we can't go to a public pool.
Which I was going on Sunday.
We might just have to go soak our toes in the water or something like that. Anyway, so from there, we were discharged. We did. They went ahead and filled the Spire cell there at the hospital pharmacy yesterday. So we went around and picked that up. And as far as we know right now, we didn't have a copay or anything like that.
Can't believe that.
Shout out to the insurance company. Can't
believe that.
Hope that keeps on going down. But right. I have been told from a friend / coworker who has a sister that's on some different cancer meds that if your insurance doesn't cover the copay, there are avenues out there to get assistance with it as well. Because these copays on these cancer medications are off the chart. So with that being said, I'm going to let Lori give you her version of what she's feeling and her thoughts from yesterday. I'm going to go grab those pics and we'll try to wrap this up. We don't want to make this a really long video. So anyway, go ahead, honey.
Okay. So whenever I actually got there, they did my vitals and everything, and I had fever. I'm not really sure why, but like Michael said earlier, apparently this is something that I'm going to be dealing with on and off through this journey. I wasn't excited whatsoever about the pharmacy consult, and if I start tearing up and stuff, it's just because I don't really think that I even want to start this medicine. But I know that leukemia will win if I don't. The holistic approach is, it's a whole lifestyle change. But I guess the thing that, concerns me the most is, having to basically live in a bubble. So I made it perfectly clear to Michael that if, and that's an if, big if, because I'm still thinking about all this, if I start this medicine, I mean, I literally can't even go to Walmart without a mask on. I can't even get around my grandchild if he's sick. I can't even get around Michael if he's sick. And then how do you even know if you're sick or not sometimes? I mean, and I'm in healthcare. I work in hospital settings all day long. I'm in and out of patients' homes. And so now this is going to affect my job? No. I mean, even if I do start this medicine, I'm not changing my lifestyle. I am going to have to, change it probably for the first week because I have no idea what this medication is going to do to me. But it was just scary. I'm not really sure how I'm feeling about everything. Kind of quiet this morning. I certainly wasn't quiet on the video yesterday. Obviously, I thought all the morphine and Ativan had wore off, but we watched it this morning, and yeah, we couldn't post that one. But we wanted to come back on here and seriously just tell you guys kind of what I felt during that bone biopsy. It it hurt. It was the worst procedure I've ever had in my life, and I've given birth twice, and I had a severed Achilles tendon repair ×2. I had a hysterectomy, a tonsillectomy, and tonsillectomy as an adult. This by far was unbelievable. It did, like he told me, it brought me up off the table. I was numb, until I guess probably yesterday evening, and then the lidocaine started wearing off, and so I started, feeling. But this morning, I'm doing really good to walk. I'm very, very sore this morning, and it wasn't in the side of the hip. It was in the back, like the back of my hip. So I was laying flat down on the table, hearing the drilling and feeling the extractions going on. It was, and I did. I'm not gonna lie to you guys because I said I wouldn't, but I cried. It hurt that bad, and I have a pretty high pain tolerance. But I cried. It hurt. But it's over now. There is a chance that I may have to go through it again. And I think I would do a lot better this time because I'm going to know what to expect. A lot of my anxiety yesterday was the fear of the unknown, but now I know. And
Yeah, I was pleasantly surprised because I had read that, people, well, everybody, I guess every physician and every practitioner is different, but I was thinking she was going to have to go through these a little bit more frequently, but the doctor and then the team that did the procedure, both sets of people reassured us that there's so much technology out there now that they really can get all the information they need off of the blood work that she'll be going and periodically doing. So I thought that was nice.
Yeah.
But like Lori said, if she had to do it again, at least this time she knows what to expect.
right.
And she might do a margarita drip or something before she gets there. So anyway, let me just show you guys a couple of pics real quick. This first one is her laying on the table, from the face view. I think one thing we didn't touch on, obviously, we being we weren't allowed to video. We weren't
Oh,
going to
yeah,
try to
that's
video
right.
it. But
We
told
did
us,
ask.
Yeah, we did ask, but they said we would have to go through their media department, and I'm sure their media department wasn't going to
Right.
allow us to do that. So they did let us take a couple of pics as long as we weren't doing anything that was in HIPAA violation. So obviously I'm not violating anybody right here, because here's the patient herself who asked me to take this picture. But you're going to tell by the look on her face, this was well before they actually started the procedure. So here's just kind of the position that Lori was in. Let me show you this real quick. Kind of a glare off of that. Hang on one second. Just hold that up there. Is that better?
I think.
Well, there was kind of a glare in the photo itself, but you can see there's Lori, and we're getting a reflection off that now.
Yeah.
So anyway, there's Lori on the table. And then this part did work so much better last night. Sorry, guys.
Oh, heck.
Close that blind over there. How about that? Bear with us. We're still getting this YouTube thing down, so and that still didn't correct the problem. Okay, if you look over there just underneath Lori's chin now, you can see that little hole right there. So that's on her back side of her hip, just above her left buttocks cheek there. So anyway, and then the last one.
See what happens when you hold it back.
That makes it worse.
Yep, it does.
Sorry, guys. So, there we go. So that is a glimpse of the 22 gauge cylinder thing that went down into that hole I just showed you guys, that had the needle in it that they used to get the aspiration out, and then the bone tissue sample. So sorry for the poor quality this morning. That was a positive, because in last night's video those did look much better. We just had to refrain from some choice words that were used in that one. So anyway, there's that. That's all I got in that department. So
So this morning, again, I'm just, well, you know, I got home last night, and I really, again, I thought the morphine and Ativan had wore off, but when I watched the video this morning, I was like, we can't, So, and I was very emotional yesterday, so I'm a little bit more solemn this morning, taking everything in again. This white blood count thing is just really, it's really out of control. And then having this secondary problem, that I'm gonna have to go get checked out, you know. Just kind of feeling beat down today. I feel like I can't catch a break. And I'm not happy whatsoever about having to start this medication. The risk for infection, you know, is making it larger for me. Almost 76,000 on my white blood count. That's absolutely crazy. I've never seen so much abnormalities in my blood count ever, and I am, you know, I can log into the portal and see the results of every single thing that they've done, and just looking at my labs, I'm just like, I skipped 1 year of going to the doctor. And so I said that to him yesterday, and he said I definitely wouldn't beat yourself up, because I really feel very confident that had you gone to the doctor last year, that your labs would have been completely normal. I actually think that you've had this since this year. So, and it kind of makes sense, because in February, this is when everything started for me. And I just thought it was stress. I'm a pretty high-strung person anyway sometimes, but you know, it's not abnormal for my pulse rate to run 88 to 90. And then working out in the gym, it's not even an option for me now. I can't even go to the gym because of infection. And my gym that I go to, Dean's Garage, it's the most cleanest gym I've ever been to. And they sterilize their equipment, but it has to do with sweat. If I was to accidentally brush arms with somebody who's sweating, I can get an infection. So, you know, I'm taking everything in this morning. I feel like maybe I need to go do some retail therapy today, but can't get my nails done anymore. Can't get my pedicures anymore. Risk for infection. Wanted to go get a tattoo with the little what is the little
ribbon,
the orange ribbon
for leukemia.
Can't do that. But anyway, that's really all I have for today. I definitely want to say thank you so much, Kelly, Holly, Maria, for the shirts, the bracelets, so much support out there from all of our family and friends. I'm so sorry if I'm not returning text messages. Yesterday was very overwhelming for me, and this whole freaking disease is overwhelming for me. So it's not that I'm ignoring you. It's like I literally forget. You know, I'm holding down a full-time job, and you know I'm supposed to come first, but you know my job comes first because I love my job, and it gives me it empowers me through this whole journey to stay strong. And you know, I have a team to stay strong for, and my team means the world to me. So I might have leukemia brain, so just, you know, don't take it personal. Feel free to text me back and go, hey, you never got back with me, and then I'd be like, oh wow, I forgot. But I don't mean anything intentional by it. But thank you guys so much for all the support, all the prayers, the bracelets, the shirts, everything. I love you guys so much. I'm just scared. Not really sure what's gonna happen. Michael did order some bracelets, and they should be in this week. And then for our family, I'll be distributing them to our family and friends. So anyway, that's really all I have. I'm just gonna get this day going, and I guess maybe some retail therapy today.
All right.
You're
So,
not Matthew McConaughey.
I'm not, but I definitely can say it like him. So with that being said, please keep Lori in your thoughts and prayers. You can tell she's very emotional, but that's not the true Lori that I know. But if I were in her shoes, I'd be a little bit emotional this morning as well. But the reason that I started the whole hashtag Lolo Strong thing is because she is a very strong woman, and attitude is what's going to help her overcome this. So she is definitely entitled to a little emotional moment this morning. But let's send out some good prayers, thoughts, and vibes for her to get that Lolo Strong mentality going again. Thank you guys for being so patient and a little bit longer presentation, but I feel like we had a lot of information to cover this morning. And so with that, hashtag Lolo Strong, and
Hey,
we love you.
Also, let me tell you, I'm getting people subscribing to this channel that I don't even know who they are. So by you guys sharing this, maybe they're going through that journey too. So what we're doing is working. So please continue to like and share these videos and get people to subscribe to this channel, so that those victims, know what to expect. There's going to be good days and bad days. But the only way we can get the word out about CML is if you, subscribe to the channel and you share these videos. So thank you guys so much for doing that. But
Absolutely. Thank you.
hashtag Lolo Strong. Love you guys.
Bye.